I'd like to welcome you to Lessons from the Field. As you know, this is a series of interviews that we do with a diverse array of guests, all of whom have a common thread, and that is a passion for pharmacy and pharmaceutical sciences. And today we're really fortunate to have James Stanley with us. James is a 2009 graduate of our PharmD program. He's currently clinical pharmacy specialist in pediatric Schumock at Spectrum Health in the Helen DeVos Children's Hospital in Grand Rapids, Michigan. And like our previous guests, I'll be asking James a series of questions that'll elucidate insight for our listeners on his career and experiences. And I'm sure those will be very enlightening for our students, alumni, and friends that might be listening. So James, why don't we go ahead and get started? We usually start with just if you could walk through your time since you left UIC, briefly, and tell us what you've been up to.
Sure. Well, I'm glad to be here. And I guess to walk you through my time at UIC, I've got to start with my fourth year, because I did a advanced ambulatory care rotation out in Tuba City, Arizona, with the Indian Healthcare Service. So I was out at the Tuba City Regional Healthcare Corporation. We serviced the Navajo and Hopi tribes out there. And at the completion of that rotation, I was fortunate enough to be offered a job to go out and practice in Tuba City. So after graduating, at the time she was my girlfriend. Now she's my wife, but she's also a graduate of our class. We went out to Tuba City, Arizona, and we lived and worked on the Navajo reservation for about 3 years. And it was just a wonderful, eye-opening experience, to immerse ourselves in a different culture and do something very different in a different part of the country. And it was a great experience too, because you learn so much about critical thinking skills, and just how to, perform our profession when resources can be limited. We were out there for about 3 years, and then, we needed to transition back to the Chicago area. So at that point, I ended up taking a job with Comprehensive Pharmacy Services. And the position I found kind of on short notice was actually working for the RX Remote Solutions division of Comprehensive Pharmacy Services. So I provided overnight remote pharmacy support for hospitals across the country. And that was very much an enlightening experience, because you saw what a pharmacist can do with, a high-speed internet connection and, a few different computer monitors in front of them. And part of that was, I did get really proficient at taking MPJEs, servicing hospitals across the country. At one point, I had 15 different pharmacy licenses. Learned a lot about different protocols, different hospitals, different software interfaces. But I did realize I really missed being in a hospital setting at that point. So with Comprehensive Pharmacy Services, I then transferred to Mercy Hospital and Medical Center right off of 26th and Michigan down in Chicago, because CPS managed their pharmacy department. I was there for a couple of years working for Mercy, and it was there that I actually first started working in an oncology forum. Because before that, it was something that was brand new to me. But, just working in the oncology position as a part of our standard responsibilities, I found it was really something that perked my interest. Just very interesting, a lot of new learning and problem solving opportunities. And when it came time to look to transition to Michigan, as my wife and I were, embarking on starting a family, I ended up working at the Helen DeVos Children's Hospital. Now that was a new adventure for me as well, because I'd never done pediatrics before. But I figured, let's give it a try and let's see how that goes. And I ended up working with the oncology team here in the pediatrics setting. And for the first couple of years I was here, I was working as a clinical pharmacist and, gradually increasing responsibilities until I became a member of our rounding team with the HEMONC rounding group. And then I had the opportunity to transition into leadership. So I worked a 50-50 breakdown of my shifts, where 50% of the time I worked clinically, and then the other 50% of the time I managed the HEMONC service line from a pharmacy perspective. I did that for a couple of years, and at that point found I really did miss, having that true clinical focus. So I had the opportunity to transition into a fully specialist role, where I worked exclusively with the HEMONC team in a clinical capacity, and then instead of managing the team, just helped to manage the service line. And that's something I've been doing for about the last 6 months now. So.
Wow, great. Well, before I go on to the next question, could I maybe just ask you a few questions in reference to what you just said? I think it's worth highlighting for those listening, and especially our students, the P4 rotation that you did for the
Yeah.
Indian Health Service. What a great opportunity, first of all. I mean, and to see something totally different, and just to say that we have these kinds of rotations that are really different, different part of the country, totally different practice model, and also that how you do in these rotations can really be important, because in this case, you were offered a job, and I've heard that from multiple
Mhm.
folks that we've interviewed and talked to over the years. So congratulations on that. That must have been great then to stay on and just see what you must have seen there,
Oh, yeah.
and how pharmacies practice in the Indian Health Service is really phenomenal, isn't it?
Oh, yeah. I mean, it's a very, very different model, and it's a fantastic model
Yeah,
because there's so much interaction directly with patients, with utilizing your three prime questions. And I mean, in terms of building up just your communication and counseling skills, I mean, it's an unparalleled experience.
yeah, it's really great. And I wanted to just follow up with you also on your next move, comprehensive pharmacy services. So maybe you could just tell for the audience a little bit more about that company and their business model, because it is, relatively unique. I'm not sure a lot of people know what these kinds of organizations do, and opportunities that they provide also for folks like our graduates.
Yeah, so Comprehensive Pharmacy Services is a pharmacy management company. And, one of the things they offer, especially what I was helping when I was working in the remote solutions division, was, helping to provide that 24/7 hospital support to facilities that might have difficulties making that work from a financial standpoint. So they could hire a company like Comprehensive Pharmacy Services, and then their clinical team has access to pharmacy services around the clock. And that's something that they can do at a much lower price point than a facility would be able to do if they had to staff a 24-hour pharmacy on their own, having your overnight pharmacist and your overnight technicians and everything that goes along with that. So it's a nice service because it allows basically the service we provide as clinical pharmacists to be expanded to people that might have difficulty supporting that from a financial standpoint.
Yeah, that's really important, and especially in smaller or rural hospitals where they just don't even have enough the workforce there. Even if they had the money to afford it, they don't have the workforce necessarily. And certainly it's a much more efficient model where you have a central location or staff that can service many hospitals at once. And that's really interesting. And I guess the next move you made then was Mercy, which sadly is closed recently.
Yes.
But I'm impressed by just the fact that you, at each move, including your most recent, you kind of took on something totally different, out of the box. Really shows flexibility and interest in continuing to learn. So that's really, I think, another important lesson maybe that I got out of what you just said. So thanks, James, for sharing that with us. So a lot of times our students in particular want to know, like, kind of, okay, what do you actually do in your job? People describe their job, and sometimes it's hard for students to relate because they don't necessarily know what that means. So maybe you could just share some details of your current job and the what do you actually do on a day-to-day basis?
Yeah. So, as a clinical pharmacy specialist here, with a focus on hematology and oncology in the pediatric setting, I spend 50% of my time rounding as the integrated pharmacist with the pediatric oncology team, which is actually what I am doing for the majority of this week. So when I'm doing that, I'm working directly with our team of attending physicians, our fellows, our residents, our advanced practice practitioners, and a variety of nurses as well. And just helping to really make sure that, not only is the chemotherapy aspect of what our patients need taken care of, but we're really addressing all of those supportive care measures and everything else that goes into comprehensive pharmacy care for our patients. So I do that 50% of the time. And then the other half of my time is basically to support the HEMONC service line. So I spend quite a bit of time in beacon validation. So our facility is on Epic. And with Epic, all of our chemotherapy is managed through the Beacon aspect of Epic. So we do all electronic chemotherapy, and there's actually a tremendous amount of background work that goes into validating, building, and maintaining these, chemotherapy treatment plans. And a lot of ours are protocol based on work from the Children's Oncology Group. So if there's an amendment that comes out, we have to go in and amend our protocol to reflect the changes. So I do that, 3 days a month roughly. And then the rest of the time would be just helping to support the needs of our team, whether that be drug information, medication safety, quality issues. All of those things would just be kind of helping to make sure that, our physicians and our patients have what they need to optimize the care we can provide.
Yeah, excellent. You mentioned in your when you briefly overviewed your career, how you kind of got into oncology at Mercy and then pediatrics. But you want to elaborate on your interest in that area at all?
Oh, just pediatric oncology in general.
Yeah, yeah.
So the thing that's just been so wonderful about working in my current environment is it's just such a fabulous team. There's such a high level of collaboration at a multidisciplinary level between our providers, our patients and families, our nurses, our child life. It really is something that as a pharmacist, you feel truly valued and you feel like you really can make a contribution into, dealing with some really challenging issues at times.
Yeah.
And knowing that, we can help to optimize some things and make some improvements and really help to drive, the safest care we can give to a really fragile patient population receiving some of the highest risk medications you could think of. Another thing that I found just so intriguing about working in pediatrics, in addition to the collaboration, is just a lot of the protocols that we use, being that they're driven by the Children's Oncology Group, are just so well organized and well delineated. So from a pharmacist perspective, being how detail oriented we all are, having that clear, concise roadmap in front of us of this is exactly the course of therapy and this is how we're going to get there in front of you is just a wonderful resource from a pharmacist perspective, because it sets clear expectations for everyone right from the start. And we can use our very scrutinizing eyes to make sure that those expectations are met at every step of the way.
Yeah, well, I can tell just by listening to you what a great fit it is. And you've kind of addressed the next question I was going to ask you a little bit, but maybe you can also elaborate a little bit more. But I mean, as a pharmacist, whether it's in the current role or in your previous roles, where do you feel like you've had the greatest significant impact or the most significant impact?
Oh, I mean, I think medication safety is just paramount. And I think that's a place where, we as pharmacists just have such tremendous opportunities, because the last thing we want to do is allow for something that's intended to help a patient to cause any inadvertent harm. And especially now with the way we have so many technological advances at our disposal, I think we're at a wonderful position to really analyze the whole medication dispensing process, identify risk points in the process, and then, help to implement change, with our nursing colleagues and our physician colleagues that can really drive safer practice. So for me, I mean, medication safety is paramount, and making sure that, we're using these high risk medications appropriately so that we're causing much more help and avoiding harm, I think is our primary role.
Yeah, right. Yeah, I can imagine how rewarding it is to be able to work with, you're not just working with the patient in the case of pediatrics, but the family and parents and so forth. And then when it's in such a important disease and such, life or death kind of decisions and impact, that's really something. So maybe stepping back now, we can go back to your time at UIC and maybe reflect on, what you did here that led to where you are now. Maybe was there a certain course or activity that really impacted you, or you wish you would have spent more time on? And then after that, I want to ask you like your advice for our current students and starting off their careers. But let's start with the UIC bit.
Yeah, so I mean, looking back, and one thing whenever I'm interacting with learners in my setting that I say is a regret of mine, is that I didn't do a more focused rotation on infectious disease. If you are planning on working in a hospital setting, having that strong infectious disease background, I think is so, so valuable, especially if you end up working in a teaching institution. Because I have found in my career, so many drug information inquiries, especially from our residents who come on service, are based on infectious disease questions. So that's something that shortly after I started practicing, I realized, wow, that was a miss on my part. Not to do an ID rotation my P4 year, because, seeing my colleagues who did have that, additional learning in infectious disease, I think whatever aspect of pharmacy you get into, especially in a hospital setting, infectious disease is always applicable, because all of us end up dealing with it at some point or another, regardless of the setting that we're working in.
Great. Well, that's great advice for our students. Very insightful, and hopefully some will reflect on that and make sure they get that opportunity. I'm sure our infectious disease faculty would be very happy to hear the pitch as well. So thanks. That's great to, when you have real world experience and that it's really great to be able to share that with those that are just going through the program and may not have that insight. So perfect. And then, for our students who are currently going through the program, or maybe even recent graduates, what advice do you have for them as they, are looking towards their careers or just starting in their careers? Anything from all your experience in the different organizations and in different practice sites that you could share?
I mean, I would say the biggest thing I would communicate to, all of the current UIC students is just be willing to be flexible and be willing to take risks and be willing to get outside of your comfort zone. Because if you would have asked me 12 years ago when I was at UIC if I would end up working in a pediatric oncology setting, there is no way I could have seen this coming. But just by, taking risks and venturing out into areas that I wasn't comfortable with, I ended up discovering what for me has been a true passion. If I was unwilling to step outside of the framework of comfort, I never would have ended up on the path I got on. And it's been so rewarding to get here. So just, every experience that a student has, go into it with eyes wide open, go into it with a real learning framework, and you never know where you may find your true passion.
Yeah, that's really great advice, James. I mean, not just while you're in school, but I think you in particular demonstrate that, like, over the first early part of your career, you were flexible and took risks, and then eventually found your true passion. So it's really shows that there's always that opportunity ahead of you, and that if you're willing to take it, who knows what you might find. So excellent. So as we wrap up, any last comments that you want to say, anything about UIC or pharmacy as a profession, or any additional advice or comments?
Well, the one thing I would say to, all of our UIC students is just to realize, how fortunate you are to be a student at UIC within the College of Pharmacy, because, the one thing that comes to mind with UIC for me is opportunity. I mean, the opportunity that, students from UIC have to expose themselves to different aspects of care. I mean, within a short walking distance of the College of Pharmacy, there's 4 major medical systems. I mean, that's unheard of. And then my story in particular, where I was able to get out to an Indian reservation out in Arizona as an aspect of my education. And that opened doors I didn't even know existed. So just, for the students to take advantage of everything that UIC offers, with its, excellent reputation and all of the different opportunities being in Chicago and everything UIC has established, just take advantage of it, because it truly is a wonderful opportunity to, find a great path and learn some wonderful things along the way.
Great advice, James. Really appreciate you being on with us today, and wish you the best as you move forward with your family and career. And James is a 2009 graduate along with his wife, Melanie, and we're really proud of what you've done and look forward to the future. So thanks, James.
Well, thanks so much for having me. I really appreciate it.